tomorrow.
California is now experiencing its worst measles outbreak in 15 years. Eyewitness News reporter Mimi Alcala joins us now with what you can do to make sure you're protected. Mimi?
Courtney, about 60 people here in California have contracted the virus recently, and today I spoke to a local physician who wants everyone to be aware of what exactly this outbreak means.
It starts typically with someone who has measles entering a community where people are susceptible.
It only takes one contagious person.
For people who are not immunized, if you're exposed to someone with measles, 9 out of 10 times you're going to become infected.
Measles cases have been spiking in California since mid-December.
With so much international travel now, measles is still very common outside the United States, so as people come into the U.S., that's where measles really starts.
The virus isn't only spread through coughing and sneezing,
but even through breathing. Someone with measles, just being present in the room can put you at risk.
And that's not all.
Measles can also live on surfaces, so if they were to cough on a surface, you were to touch it and touch your face, you've just infected yourself.
Dr. Benjamin Haas says now that California is experiencing a measles outbreak after many became sick with the virus while visiting Disneyland, it's important to make sure everyone is immunized.
Red eyes, runny nose, a cough, and typically about 3 to 5 days after those symptoms begin, you'll have a rash that starts at the head and kind of spreads down the body. That's really the telltale sign of measles.
And it can get worse.
Some kids develop ear infections that can lead to hearing loss. People infected with measles can develop pneumonia, which can be fatal. And the very rare complication would actually be swelling around the brain, which can be very dangerous.
The 2-dose measles vaccine is typically 97% effective, but for people born after 1957 and before 1971, that vaccine wasn't so effective.
So you may want to get tested just to be sure you are immune.
All it takes is a simple blood test.
We just look for the antibodies against measles, and that will tell you if you're immune.
And if you aren't immune,
you can receive another dose of the booster, which may help to reduce your risk of actually contracting the illness.
Now, if you think you may have been exposed to the measles, call your health care provider to set up arrangements to prevent spreading the virus. And if you haven't been vaccinated before, health officials say to stay away from Disneyland. Kurt?
Thanks, Mimi. A Delano man arrested